صباح الخير.
صباح النور.
واضح الصوت يمكن؟
واضح دكتورة.
تمام. اليوم نبدي بالفيميل Reproductive System. راح ناخذه على محاضرتين نكمل اليوم إن شاء الله. First, the female reproductive system divided into four main parts, and starting first with the paired ovary on each side, the oviducts أو called the uterine tubes اللي هي link between the ovaries and the uterus, and the uterus is divided into the body and the lower part اللي هو cervix, the vagina, and then the external genitalia. The function of the female reproductive system mainly is the production of oocytes. And the oocyte, when fertilized with the sperm, will form the embryo, and then the embryo is planted into the uterus that provide a suitable environment for the growth and development of the embryo. Also, the production of steroidal sex hormones اللي هي estrogen and progesterone, and those hormones are important for the reproductive function. Starting first with the ovaries, which are paired and almond shaped. These are the ovaries that have the almond shape, and the size is 3 by 1.5 centimeter, and the thickness is about 1 centimeter. The ovary is covered. This is the cross section of one ovary. The covering, the outer covering, is continuous with the serosa, and it's lined by simple cuboidal epithelium, and overlying a dense connective tissue layer, which is the tunica albuginea. Tunica albuginea اللي هو similar covering شفناه in the testis. Most of the ovary consist of the cortex, which is a highly cellular connective tissue and containing the ovarian follicles. The ovarian follicles at various stages of development. So this, the cortex, which is largely consists of high cellular connective tissue, and it's the site where the ovarian follicles develop. And the smallest part here, the deepest part, is called the medulla, and it's loose connective tissue, less cellular than the cortex, and it contains here the blood vessels, arteries, and veins that come or enter into the ovary through the hilum from the mesentery that suspend the ovary. The ovarian follicles, which is located mainly within the cortex and present at various stages of development after puberty. It consists of an oocyte, and this oocyte is surrounded by one or more layers of epithelial cells within a basal lamina. The ovarian follicles that formed during the fetal life is called the primordial follicles. And the primordial follicle consists of primary oocyte that has a large nucleus, which is arrested at the prophase of the first meiotic division. The primordial follicle will become arrested at this stage of division, and it continues to be arrested until puberty. The ovarian follicle is supported or covered by a supporting cells which are called the follicular cells. This is the section of the ovary again, and it shows the follicles at different stages of development. This is the primordial follicles that develop during the fetal life and stop their division at about 12 weeks of gestation and remain this way until puberty, from 12 to 14 years old, under hormonal stimulation, hormone released from the anterior pituitary gland, the FSH hormone, or follicular stimulating hormone, will stimulate those follicles to grow and develop until it forms the mature follicle that will release the oocyte from the ovary, and this process is called ovulation. The first type of follicle that form after primordial follicles is called the primary follicle, which then develop into a second type, larger, more developed, called the secondary follicle, and then the secondary follicle change into the mature follicle or called the Graafian follicle. After its release from the follicle, this is unovulated. The remaining cavity of the follicle will undergo also a series of changes until it forms what is called the corpus luteum, the yellowish body, and change eventually into the white body, which is called the corpus albicans. All these changes occur in the ovarian cortex. The release of follicular stimulating hormone, and as the name implies, its major function is stimulating of these follicles to grow and develop. A small group each month will develop under the influence of FSH, and it begins the process of the growth. The oocyte will grow rapidly during the first part of follicular development and change from the 25 micron into 120 micron in size. The first stage of follicular development, the primordial follicles that are present from the intrauterine life within the ovaries and under FSH at puberty, it will start to develop. First, this is the appearance of the primordial follicles, which consist of primary oocyte that is arrested at the first meiotic division, and the enveloping is these cells. Follicular cells, the supportive cells, are flat, single layer of flat follicular cells and containing the primary oocyte. And the change of primordial follicle into this type of primary follicle under hormonal influence, it will affect the follicular cells. It will change from the flat, هذا الappearance الفlat يتغير إلى this appearance, from flattened into simple cuboidal epithelium that surrounds the growing and enlarging primary oocyte. And this stage, the primary follicle, is divided into two steps or two stages. The first is called the unilaminar primary follicle, and the second is the multilaminar primary follicle. Unilaminar means single layer and refers to the layering of the follicular cells, and multilaminar means multiple layers of follicular cells. So here, the primary follicle change into simple cuboidal. In the unilaminar stage, it is a single layer. In the multilaminar stage, the cuboidal epithelial cells are arranged into multiple layers or stratified layering. And at this stage, these follicular cells are now called granulosa cells. At this stage, the second part or second stage of primary follicle, a layer of an extracellular material will accumulate between the developing granulosa cells and the primary oocyte. The zona pilosida, this layer اللي هي قلنا عن extracellular material, is important during the process of fertilization. It contains substances that will bind to sperm receptors and help the activation of acrosome. أخذنا ذاك الأسبوع الأكروسوم اللي هو موجود at the tip of the head of sperms, and it helps to penetrate the oocyte by secreting enzymes. The activation of these enzymes is helped by the substances present in the zona pilosida, certain glycoproteins here that bind to sperm receptors and activate the acrosome. Also, the stromal cells that surround the follicles. Ovarian stroma is called stromal, ovarian stroma, اللي هي تتكون قلنا من connective tissue, highly cellular in the cortex and loose in the medulla. The developing follicles is surrounded by these stromal cells, and the stromal cells that are immediately surrounding the developing follicles differentiate into two parts called the theca cells. The ones that are immediately around the developing follicle is called theca interna, and the outer one is called theca externa. Theca interna is rounded cells, and they are important because they secrete hormones اللي هي hormone precursors estradiol اللي هي يصير بها diffusion into the granulosa cells, and within the granulosa cells by secreting the aromatase enzyme it will change into estradiol اللي هو active form of estrogen, and then the estrogen will be released into the circulation to exert its effect on the reproductive organs. The theca externa is mainly stromal cells اللي هي fibroblasts, smooth muscle cells, and they merge gradually with the surrounding ovarian stroma. The next part after the primary follicle هو ال secondary follicle. Another name هو ال antral follicle. And it's called antral because it contains a large cavity that is formed between the developing granulosa cells containing fluid called the follicular fluid or antral fluid that will be released during ovulation along with the oocyte and the surrounding granulosa cells. The granulosa cells here, as you can see, will form a crown-like, tightly adherent cells around the primary oocyte, and this part of granulosa cells is called corona radiata. This part will be released with the oocyte during ovulation. The last part is the mature or Graafian follicle. And during each cycle, usually, although the process starts with a group of cells starting to grow, but usually only one follicle will reach this stage, here, stage of full maturity, in mature or Graafian follicle. And all the other developing follicles, including primary and secondary follicles, will undergo a process of atresia اللي هو degeneration. The mature or Graafian follicle is the largest here and contain more fluid. The most prominent change here is the more expansion and much increase in size until it reach about 2 centimeters. And this is the corona radiata. This is the primary or secondary oocyte هنا at this stage just before ovulation. Usually قلنا primordial follicle contain the primary oocyte that is arrested at the first meiotic division. And until puberty and under hormonal influence, the primary oocyte will remain in this stage until just before the ovulation. The primary oocyte will continue the first meiotic division, forming secondary oocyte. So this stage, secondary, happened just before the ovulation. Follicular atresia is the degenerative process in which the follicular cells will undergo apoptosis. And apoptosis means cell death. And the product that will be released from the breakdown of cells and death will be removed by phagocytic cells. Phagocytic cells are inflammatory cells and macrophages that will engulf or swallow these byproducts of breakdown and remove it from the site. And the whole process of cell death is called the degeneration or atresia, follicular atresia. The process of ovulation is a highly regulated, tightly regulated hormone process in which usually a single oocyte is released from the ovary. With the normal circulation or the average circulation اللي هي about 28 days. The normal menstrual cycle duration range from about 21 days to 40 days. The average is about 28 days. So suppose that the normal cycle is 28 days. The half of the cycle is the day of ovulation, who are day 14. And usually only one follicle is liberated each cycle, and certain occasions, rarely 2 or more can be expelled simultaneously from the ovary. The released oocyte is the secondary oocyte that has completed the first meiotic division. This whole process is under hormonal influence, قلنا from the follicular stimulating hormone released from the anterior pituitary gland, and it's controlled by the gonadotrophin releasing hormone GnRH, which is released from the hypothalamus. The next type of hormone which is released along with FSH during the cycle is the LH hormone, luteinizing hormone. And this hormone is particularly important for the process of ovulation. The marked increase in LH at the time of ovulation, just before the about 12 hours of ovulation, there will be a marked increase called LH surge. And this increase in LH will leading to a series of events that will end with the ovulation, اللي هي the process of release of oocyte from the ovary. During the development of mature follicle, or Graafian follicle, and because of the expansion in size, because of the increase of fluid accumulation, this increase in the pressure of the expanding follicle will cause bulging. هنا اللي نشوفه هذا الانكريز، هنا نشوفه site. This is the bulging at this site. The expanding or increasing, enlarging mature follicle will compress against the wall. This compression will cause an area of ischemia, اللي هي lack of blood supply by pressure. And this ischemia at this area of the ovary against the tunica albuginea is called the stigma, causing a breakdown at this weak point. after its ovulation, if the released ova or oocyte is not fertilized within 24 hours, it will begin to degenerate. And again, degeneration means the cell death. After the release of the oocyte from the mature follicle, there will be a remaining cavity. The oocyte released along with the surrounding granulosa cells, سميناها corona radiata, and the fluid from the surrounding cavity. The remaining cavity اللي هو of the follicle containing or lined by granulosa cells will change in what is called the corpus luteum of the ovarian cycle or of the menstrual cycle. The remaining follicular cells in the wall will redifferentiate under the influence of LH hormone. The FSH hormone, two hormones released from pituitary that act on the ovary are the FSH and LH. The FSH hormone is predominant during the first part of the cycle, اللي هو first 14 days. At 14 days and after ovulation, the predominant hormone in the second part of the cycle هو من يوم 14 إلى يوم 28, the predominant hormone is LH. The LH will act on the remaining cavity to develop the corpus luteum, yellowish body. The granulosa cells here will increase in size, much increase in size, and we can see here this is great folding and thickening of the wall of the corpus luteum with formation of blood, forming blood clot at the cavity of the former antrum. Both the granulosa cells and theca cells will change under the effect of LH, and the function of the corpus luteum during the second part of the menstrual cycle is the production of progesterone, in addition, of course, to estrogen, but the second part of the cycle is the progesterone is the more predominant. Estrogen is predominant in the first part of the cycle. So, the first part of the cycle, FSH and estrogen is the predominant, and the second part of the cycle, the LH and progesterone is the predominant hormones. Here we can see the granulosa cell layer that increase in size, about double their size compared to the granulosa cells in the developing follicles. In the corpus luteum, the granulosa cells now are termed granulosa lutein cells, and the theca cells in the corpus luteum is called theca lutein cells. These are the darker staining cells, are the lutein, and the larger cells, about double the size here of the theca cells. The darker staining cells here are the lutein, and they are concentrated, as you can see, within the folds of the wall of corpus luteum. The fate of the developing corpus luteum or yellowish body depends on whether the pregnancy will happen or not. The ovulatory LH will causing the corpus luteum to secrete the progesterone اللي هو predominant for up to 10 to 12 days اللي هو the second part of the cycle. But this LH release اللي هو اللي قلنا predominant during the second part of the cycle will decline after this period, and it is the LH that maintain the progesterone production and the continuity of the corpus luteum without any further release of LH. And in the absence of pregnancy, وهسنعرف ليش next and ليش pregnancy can maintain the corpus luteum. The corpus luteum after this period will undergo regression. Again, regression قلنا it is apoptosis, process of degeneration, and with the regression of the corpus luteum اللي هو مسؤول عن production of progesterone, cause the drop in the progesterone level, and the drop in the progesterone level will cause shedding of the superficial layer of the lining of the uterus اللي هو called menstruation. يصير sloughing للlining of the uterus and shedding of blood اللي هو process of menstruation. After its regression, the fibroblast will start to act on the site of the previous corpus luteum, and it will lay down connective tissue اللي هو scar tissue يعني fibrous tissue is called the whitish body to present the previous site of corpus luteum. The corpus luteum of a pregnancy, قلنا without ovulation and without pregnancy, the corpus luteum will degenerate. However, when pregnancy occurs, the implanted embryo cells, اللي هي trophoblast cells, will produce the human chorionic gonadotrophin hormone, the HCG hormone. This hormone has an action similar to the LH, and it will act on the granulosa cells of the corpus luteum to maintain the production of hormone. This is important during the pregnancy because the progesterone is important to maintain the lining of the uterus from being shedded to keep the utero implanted in the uterus. Because if there is a drop or reduction in the progesterone production, there will be sloughing and loss of the lining of the uterus along with the implanted embryo. This production of HCG by the developing embryo will last for up to 4 to 5 months. After that, the developed placenta itself will start to produce progesterone. There's no need for HCG that stimulates corpus luteum to produce progesterone. The placenta itself will produce progesterone that maintain the lining of the uterus from being shedded. So, after this time, the corpus luteum, اللي هو سميناه corpus luteum of pregnancy, which lasted for 45 months, is no longer needed. So it will degenerate and replaced by corpus albicans also, but it's different from the corpus albicans of the menstrual cycle by being larger in size. The second part of the reproductive system is the uterine tubes, or called the oviducts. There are a uterine tube on each side of the uterus with about 10 to 12 centimeter length, and they open into the peritoneal cavity here near the ovary. Consists from 4 parts. This part that has a dilated or finger-like projections called the infundibulum. The second is the ampulla, isthmus, and small or short intramural part. The infundibulum, which has these small finger-like projections called the fimbria. These finger-like projections is important because it helps the uterine tube to pick up the oocyte that is released from the ovary, and then transports the oocyte here further through the uterine tubes until it reaches into the uterus. Within the uterine tubes, here the second part, which is usually where fertilization occurs. Here usually the oocyte and the sperm fertilize to form the embryo, and it will then transported here to be implanted within the uterine wall. This is the longest part, and this is the isthmus, and this is the short intramural part. It's passed through the wall of the uterus, and here it opens into the interior of the uterus. The wall of the oviduct is divided into 4 parts. As you can see here, first the mucosa, and you can see the mucosa is complex branching and longitudinal folds with simple columnar epithelium of 2 parts, ciliated, that help to sweep the fluid toward the uterus, and the non-ciliated. The non-ciliated has a secretory function to provide substances important to provide nutrition for the passing oocyte, and a supportive loose connective tissue underlying lamina propria, loose connective tissue, and the muscular wall, which consists from inner circular and outer longitudinal layers of smooth muscles, and the serosa. Serosa, which is covered by a layer of mesothelium lining. The folds here are most prominent in the ampulla, forming a labyrinth-like, and they much decrease in their foldings in the third part or isthmus, and these folds are absent in the intramural part. The third part is the uterus, and it divided into 3 parts: the fundus, the body, and the lower cylindrical part, which is the cervix. The layers or the wall of the uterus is divided also into 3 layers. The lining mucosa layer, and here in the uterus is called the endometrium. The muscular wall, which is a thick and highly vascularized smooth muscle layer called the myometrium, and an outer connective tissue layer called the perimetrium. The mucosa layer, the endometrium, is divided into 2 parts. The outer superficial layer called functional layer, and a smaller basal layer here. The functional layer, اللي هي the major part of the endometrium, is the part of the mucosa that will be sloughed and shedded during the menstruation, while the basal layer is preserved, it's not shedded, and present a site for regeneration and replacement of the shedded functional layer. You can see here the endometrium that consists of lining epithelium, and type of epithelium here is the simple columnar epithelium, which has both also ciliated and secretory cells. The underlying lamina propria, and here called the uterine stroma, contain a fibrous tissue, mainly type 3 collagen with abundant ground substance. The entire thickness of the endometrium is penetrated by numerous uterine glands. These are the uterine glands, who are similar lining, simple columnar epithelium. So there is surface epithelium and glandular structures, uterine glands are present in the endometrium. The layers of the endometrium, again, it's divided into 2 parts: a larger, more superficial part, which is the functional layer. That is, this layer is lost each month and sloughed, then replaced again by another growing layer. And the basal layer, اللي هي the base for the development of new functional layer. Here, the figure A is the basal layer, and it's adjacent just next to the myometrium. This is the muscular wall. It is usually more cellular, and here it contains the ends of the uterine glands. The uterine glands penetrate the entire thickness of the endometrium, the functional and the basal layer. The basal layer near the muscle contains the ends of the uterine glands. This is small blood vessels and artery within the basal layer. The functional layer, which is more superficial, and which includes most of the length of the developing uterine glands, in addition to the surface epithelium. The functional layer, the layer that is shedded during menstruation, is hormone sensitive or undergo profound changes during the menstrual cycle, while the basal layer remain unchanged during this hormonal changes, unaffected by the hormonal change during the menstrual cycle. The arterial supply of the endometrium is very important because it is hormone sensitive arteries and they represent the base for the changes in the endometrium. It's divided into two parts. The arcuate artery, اللي هو branch of the uterine artery here. This is the arcuate artery, give branches into the endometrium. This is the basal layer and the superficial functional layer. The first part of arcuate artery is called the straight arteries. This is the straight arteries. This is responsible for providing a blood supply for the basal layer. And this part is hormone insensitive. The artery is not responsive to changes in hormone. While the branches from this straight artery is called the spiral arteries, and the designation comes from its shape. It's spiral in shape, long and spiral, highly branching arteries that extend upward into the entire functional layer here and up into the most superficial part. It gives a network of thin-walled, delicate capillary network, vascular lacunae that will drain into the venules. This part is hormone sensitive, and the responsiveness of the spiral arteries to the hormone changes will give the shedding in this functional layer. The myometrium, which is the muscular layer, and characteristically the muscular wall of the uterus is very thick, and during pregnancy it will undergo marked hyperplasia and hypertrophy to provide a thick wall important to induce a forceful contraction during labor to expel the child. This is the endometrium. You can see here the branching, uterine glands, surface epithelium. This is the basal layer, and this is the functional layer. Next here is the thick, smooth muscle wall, the myometrium. Contain network of blood vessels and lymphatics. The characteristic feature of the smooth muscles is the interwoven layers. So they run in different directions and they run or arrange parallel to the long axis of the organ. During pregnancy, the extensive growth of the myometrium, the smooth muscle layer, is a combination of hyperplasia, hypertrophy, and increased collagen production. It provides strength to the uterine wall, and after pregnancy, these muscles will shrink and break down by apoptosis. قلنا هو cell death, or called the programmed cell death. This process helps to eliminate the cells in the body that are no longer needed, and the elimination of much of the increase in the smooth muscle layer will bring back the uterus into the pre-pregnancy state. The menstrual cycle starts from the puberty until menopause. At puberty, the menstrual cycle beginning, which is called the menarche. Menarche is the first menstrual cycle. And menopause means the cessation of menstruation, which this process usually lasts few years. The menstrual cycle begin to become irregular gradually until completely cease. This process is under hormonal influence. The hormones from the pituitary gland, which are FSH hormone and LH, the follicle stimulating hormone, and luteinizing hormone, which produce the cyclical changes in ovarian hormones by acting on the development of follicular hormone, ovarian follicles, and ovarian follicles produce estrogen and progesterone. The hormone released from the ovary, the estrogen and progesterone under the influence of pituitary gland hormones, will in turn act on the endometrium, causing also a cyclical changes during the menstrual cycle. The changes in the ovarian cycle coincide with the changes in the uterine cycle or menstrual cycle. The menstrual cycle is divided into 3 parts. The menstrual phase lasts from 1 to 4 days, اللي هو first day of the cycle until 4th day. The first day of the cycle is the first day of the blood shedding. The first day of bleeding is called the first day of the cycle, and it lasts on average from 1 to 4 days. After the end of menstruation and shedding of the endometrium, the functional layer of endometrium, a process of proliferation to compensate for this lost layer is called the proliferative phase. And this proliferative phase or proliferation in the endometrium, it coincides with the follicular phase of the ovarian cycle. قلنا the first part of ovarian cycle اللي هو تقريبا 14 days is the period of predominant follicular growth and development, in which the predominant hormone is estrogen. Therefore, the proliferative phase is also called follicular or estrogenic phase. And this lasts from the day 5 to day 14 until the day of ovulation. After ovulation, the menstrual cycle phase here is called the secretory phase. Mainly, there will be secretory changes within the uterine glands. And this uterine phase, the secretory, coincide with the ovarian cycle phase, اللي هو luteal phase, قلنا predominant hormone هو LH, that acts on the release of progesterone. Therefore, the secretory phase, also called progestational or luteal. And this lasts from the day after ovulation, 15 to day 28, اللي هو قلنا average length of the menstrual cycle. This is the presentation of the ovarian cycle, اللي هي قلنا ovarian cycle اللي هي cycle يصير بها series of changes in the follicles. In day 14 ovulation, after that the formation of corpus luteum until the end regression, formation of corpus albicans. These changes correlate or coincide with the uterine cycle. Changes on the uterine cycle, the hormones released from here act on the endometrium. So the follicular phase here, predominant growth of follicles that release predominantly estrogen. The estrogen released will act on the endometrium to induce the growth. Therefore, it's called the proliferative phase. And after ovulation here and formation of corpus luteum under LH influence, the corpus luteum will start to produce progesterone. Progesterone will act on the endometrium to induce secretory changes. Therefore, it's called secretory phase. And this is the luteal phase. The secretory phase coincides with the luteal phase, same period, proliferative phase with the follicular phase. After the end of menstruation, it lasts for 1 to 4 days, the mucosa reach its thinnest part هنا. This is the beginning of menstruation اللي هي the thickest period of endometrium. After shedding, there will be loss of this superficial part of endometrium, and here after the end of menstruation, the endometrium reach its thinnest اللي هو نص مليمتر 0.5 millimeter. Under the influence of estrogen, the estrogen function is induction of proliferation of cells. So it will induce the regeneration of the functional layer that has been lost during the period of blood loss, the menstruation. The proliferation occur or arise from the basal layer. The basal layer will not be lost. It's the layer that's responsible for the formation of the cells that compensate for the lost functional layer. The basal layer that contains the ends of the uterine glands. The uterine gland ends will start to proliferate, and the proliferating cells will migrate to form the functional layer, including the surface lining, epithelium. During this period, the newly formed uterine glands are relatively straight, and they are empty lumens. There are no secretions. They are small and straight glands. Also, the spiral arteries will lengthen and form an extensive microvasculature. At the end of this proliferative phase, the endometrium thickness is about 2 to 3 millimeters. The secretory phase, which begins after ovulation, the secretory phase coincides with the second part of ovarian cycle, اللي هي a period of predominant progesterone production from the corpus luteum. The epithelial cells here of the uterine glands begin to secrete and accumulate glycogen. هنا نشوف uterine glands are dilated and has infoldings or coiling in the glandular lumen with abundant glandular secretions. نرجع هنا نشوفها straight, small, and lack secretions, while in the secretory phase they are enlarged, dilated, and filled with secretions. Also, there will be increase or dilatation of formation of the network of thin-walled blood vessels in the superficial microvasculature. شوف هنا there is blood vessels, but they are not extensive and dilated as in the secretory phase. These are the dilated vascular spaces, network, microvasculature, capillary network. These are the red blood cells within the capillary lumen. During the end of the secretory phase, the endometrium will reach its maximum thickness, which is about 5 millimeters. This marked increase in the thickness is due to the edema of the stroma in addition to the accumulation of secretion. And last is the menstrual phase. The menstruation is the process of shedding or breakdown This process occurs because there will be no much production of LH hormone from the pituitary. Again, the LH hormone is responsible for the maintenance of corpus luteum. Without LH, the corpus luteum will regress, and the regression in corpus luteum, which is responsible for production of progesterone, will cause a drop in progesterone. And the drop in progesterone is the key for the shedding and the onset of menstruation. The effect of drop in progesterone on the shedding of the functional layer is due to its effect on the vascular layer. That's why we said that the spiral arteries are the hormone sensitive and they are the key element in the menstruation process. The reduction in progesterone produced two effects. First, the spasm of muscular wall spiral arteries, and this will reduce the blood flow into the functional layer. Reduction in blood flow will causing ischemia, hypoxia, and can cause cell death and shedding. Also, the reduction in the progesterone will affect the production of prostaglandins, increase their production, and these prostaglandins can cause vasoconstriction of the spiral arteries. And if there's vasoconstriction in the arteries, this will lead to reduction of the blood supply, also into the functional layer. Therefore, the menstrual discharge will begin by shedding of this layer اللي هي الفانكشنال layer. قلنا صارت بيها ischemic changes under the influence of a drop in progesterone and damage. This will lead to its shedding and sloughing as menstrual flow called the menses. And the mens consists largely of degenerated endometrium, which is mixed with the blood from the breakdown ruptured microvasculature present in the superficial layer of the functionalis. The next part is the cervix اللي يعتبر lower part of the uterus, cylindrical lower part. And this is important as it's histologically different from the rest of the uterus. This is the uterine tubes, fundus of the uterus. The body forms the largest part of the uterus, and the lower here, the cylindrical part, is called the cervix. The cervix itself is divided into two parts. An inner part, which is continuous with the lining of the uterus, called the endocervix, and an outer part, which is continuous with the vagina and called the ectocervix. The lining of endo and ectocervix is different. The lining of the endocervix is similar to the lining of the uterus, which is columnar epithelium, and the lining of the ectocervix, which is continuous with the vagina, is the squamous epithelium, who are similar to the lining of the cervix. The area of meeting between the endo and ectocervix is called the transformation zone. As you can see here, this is the area of meeting between the ectocervix, the outer part of the cervix, and here you can see the lining is stratified squamous epithelium, while the inner part, which is continuous with the uterus, is called the endocervix, and the lining is similar to the cervix, simple columnar epithelium with the presence of underlying cervical glands. This is function to secrete the mucus, cervical mucus. The characteristic feature of the cervix that differs from the uterus is that it lacks the spiral arteries. قلنا the spiral arteries هي hormone sensitive, and its responsiveness to changes in hormone will lead to the cyclical changes and the menstruation. Therefore, it does not change in thickness and does not shed during menstruation. Thickness average is about 2 to 3 millimeters. At higher magnification, you can see here the lining, simple columnar epithelium, and the underlying mucus secreting glands. This is the endocervix. Nana el-ecto and endo, and this area is the transformation zone. The cervical area around the external os, نرجع هنا نشوف الاكسترنال os هي الاكسترنال opening of the cervix and the internal os اللي هي internal opening of the cervix. The area around the external os is covered by the exocervical mucosa. The exocervical mucosa is continuous with the vaginal lining اللي هو يكون stratified squamous epithelium, non-keratinized type. Here, this section also shows the meeting between the ectocervix, stratified squamous epithelium, and the upper part of cervix, endocervix lining هو simple columnar epithelium with underlying mucus secreting cells, glands. This is the transformation zone اللي هي area of change from columnar epithelium into squamous epithelium. This is particularly important because changes within this area is important. This is usually the most common site for carcinoma formation in the cervix. Therefore, even the screening for carcinoma usually targeted at this area, transformation zone. Under the effect of progesterone, also the cervical mucosa will change cyclically, but the changes mainly is for the mucus secretion. And the changes here is important for fertilization and early pregnancy. During ovulation, the cervical mucosa usually is abundant and copious, and this abundant secretion helps the sperm movement to reach the site of fertilization. During the luteal phase, the mucus is more viscous, and this will prevent passage of further sperms. During the pregnancy, the mucus is even much viscous in consistency, and this will act as a plug to seal the cervical canal. The fourth part is the vagina, which is a fibromuscular tube, and it lacks the glands. Glands that are present in the uterus and cervix here in the vagina are absent. The vagina wall consists of 3 layers: mucosa, muscular wall, and adventitia. The mucosa lining, again, it is similar to the ectocervix, اللي هو non-keratinized stratified squamous epithelium. The characteristic feature of the squamous epithelium lining of the vagina is that it accumulates large amounts of glycogen. Glycogen appear histologically as area of clearing. You can see here the squamous cells are appearing as clear cells. These are the darker staining are the nuclei of the cells, and the surrounding here is the cytoplasm that accumulate a large amount of glycogen, appear as clearing. The glycogen is important for the vagina because it will be converted into lactic acid by the bacterial flora. Normally there is a bacterial flora in the vagina اللي هي non-harmful bacteria. The bacteria will convert glycogen into lactic acid, and this is very important because it will keep a low pH in the vagina, and this has a protective effect to prevent the growth of the pathological type of bacteria. Therefore, it's recommended not to use any form of vaginal wash that can disturb the normal bacterial flora and disturb the normal low pH. This will cause thriving and growth of the pathological type of bacteria causing infections. The muscular wall consists of inner circular and a thicker outer longitudinal layer. The adventitia, which is dense connective tissue that is rich in the elastic fibers, giving the elasticity and flexibility to the vaginal wall. The external part, or the last part of the female reproductive system, is the external genitalia, or the vulva. And it's divided into 4 structures. All are lined by stratified squamous epithelium. The vestibule, the inner lips, or the labia minora, and the outer lips, the labia majora, and this is the clitoral hood, or the clitoris. The vestibule is a space where the wall containing glands. These glands produce mucus secretion, help in lubrication, and the labia minora, which are small folds of skin characteristically lacking the hair follicles, unlike the labia majora that contain the hair follicles. The labia minora containing numerous sebaceous glands. And finally, here the clitoris, the tip that is an erectile tissue, erectile structure similar to the penis containing paired corpora cavernosa. This is only the tip, the inner, deep into the structure. There are 2 structures, 2 erectile structures, paired corpora cavernosa, and the mucosa of these structures, the vulva, contain abundant sensory nerves and tactile receptors, which is important for the erectile function. And the last part here is the mammary gland. The mammary gland is not included within the genital system, but it's studied here because the changes, hormonal changes of the reproductive system has a functional influence on the state of the mammary gland. The breast is considered as an accessory gland of the skin or modified sweat gland. And each gland consists or divided into lobes. These are the lobes. The average number of lobes, about 15 to 25, and they consist from a complex tubulo-alveolar structure, where the main function is the provide the nutritive milk for the newborn baby. Each lobe is separated from others by dense connective tissue and also the supportive adipose tissue. Each lobe can be considered as a separate gland, and it's divided into numerous lobules. Here are the lobules. This is the lobe, and those structures, smaller units or smaller structures, are called the lobules. The lobules also called the terminal duct lobular unit because it consists of lobule and its associated terminal duct. This is the terminal duct lobular unit, and here it consists from this lobule and the terminal duct, which is divided into 2 parts, and extralobular part and intralobular part. The lobules here consist from smaller units. These are the smaller units that are called the ductules or the acini. The ductules or the acini, the alveoli are oval to round and lined here by simple cuboidal epithelium. Between those cells and the basal lamina, here a specialized type of cells, the myoepithelial cells. These are stellate-shaped cells that present in the alveoli, and the function of myoepithelial cells is having a contractile activity or function, and this can cause contraction that help to expel the milk produced within those alveoli. The duct system قلنا lobule or terminal duct lobular unit consists of the acini and duct. The duct system, starting from the smallest branch of the duct, which is found inside the lobe, therefore it's called intralobular duct. This part is within the terminal duct lobular unit and is called the intralobular terminal duct, and the one that is outside the lobular unit is called the extralobular terminal duct. It drains into enlarging duct system, branching duct system, which will join together to form the main excretory duct, اللي هي lactiferous duct. This is the lactiferous duct that will having here a dilated part called the lactiferous sinus that will drain into the collecting duct and then into outside through the nipple. This is the histological appearance of the terminal duct lobular unit. These are the lobules, or the terminal duct lobular units, and these small structures here are the acini, or the ductules, and this is the terminal duct. The stroma between these lobules is called the interlobular stroma. The next picture on the right here is a magnification of this appearance, and as you can see here, this is the lobule, this is another lobule, and these structures here within the lobule are the acini. The stroma that lies between those acini within the lobule is called the intralobular stroma. And this is the stroma that lies between each lobule is called interlobular stroma. The lactiferous duct that drain each lobe is about 2 to 4.5 centimeter, and it emerges in the nipple that contain 15 to 25 pore-like openings, which is 0.5 millimeter in diameter. The lactiferous sinuses are lined by stratified cuboidal epithelium, while the lining of all other type of ducts, the lactiferous ducts, the terminal duct, is simple cuboidal epithelium with myoepithelial cells. The duct system is embedded into loose vascular connective tissue and dense, less cellular connective tissue that separate the lobes, اللي هو intralobular and interlobular stroma. In the premenstrual phase of the reproductive cycle, this connective tissue become much edematous, and this will make the breast feels slightly larger, اللي هو edema within the connective tissue that gives this larger size. The areola, which is the skin immediately surrounding the nipple, contains sebaceous glands and abundant sensory nerves, and is continuous with the mucosa of the lactiferous sinuses. The areola contain more melanin than the surrounding skin, and it darkens further during pregnancy under hormonal influence. The estrogen hormone that increase during pregnancy will stimulate the melanin production in the areola, therefore its color become darker during pregnancy. The connective tissue in the nipple also is rich in smooth muscles, and this will produce nipple erection during contraction. This is help during the process of lactation. During puberty, the breast will start to develop. Before puberty, it is in both sexes, both male and female. The breast consists only of lactiferous sinuses near the nipple with a very small branching ducts. During puberty and under the influence of estrogen hormone, the breast will start to grow by elongation of these small branching duct and the deposition of adipocyte. In non-pregnant adult women, each lobe consists of many lobules, لقينا اسمها terminal duct lobular units, and each lobe has several branching ducts, but the adult secretory units remain small and rudimentary. The breast only reaches its full stage of development or maturity during lactation. It starts to develop more during pregnancy, but until lactation is the period of full maturity of the breast. And even in the adult non-pregnant woman, it's considered as small and rudimentary. During pregnancy and lactation, the alveoli will develop and undergo growth under hormonal influence, estrogen, progesterone, and prolactin. The alveoli epithelial cells will proliferate and much increase in the size. This is an inactive breast اللي هو adult but non-pregnant woman can see the alveoli are still small and rudimentary appearance, and pregnancy start to grow and proliferate, increase, and the full maturity is reached here during lactation, in which the stroma is much decreased and the lobule consists mainly from prominent alveoli, in addition to inflammatory cell infiltration, lymphocytes, and plasma cells. Later in pregnancy, the alveoli and the duct become dilated here and filled with secretions that are called colostrum, which is protein-rich fluid that contain also immunoglobulins and produced under the influence of prolactin. Prolactin is secreted from the pituitary gland and it is responsible for the production of milk from the breast. You can see here the state of lactating breast, which consists mainly of acini filled with much secretions, the milk. These are large dilated ducts, also contain the milk. After labor, parturition, the alveoli will start milk production under influence of prolactin hormone, and this secreted milk is rich in nutrients, protein, lipid, lactose, in addition to other elements, iron and calcium. This is important to provide proper nutrition for the newborn baby. After weaning, the alveoli and ducts will regress. قلنا regression here degenerative process, apoptosis to eliminate the unneeded cells and the products of breakdown removed by the phagocytic cell, the macrophages. The breast will return to inactive, the pre-pregnancy state. After menopause, the alveoli and ducts are also reduced further in size with the breakdown of collagen fibers and the loss of the fibroblasts. Fibroblasts, which are the cells that are responsible for laying down of fibrous tissue, including the collagen.